In today's video, I am going to tell you how I managed to work 3 jobs without being insanely crazy. My name is Tawanda. I am a registered professional nurse. I currently work 3 PRN jobs as a registered professional nurse. I am a home health admissions nurse for all 3 companies, and I hold a PRN status. First, I'm going to answer a frequently asked question, and that is, why 3 jobs? The reason why I hold 3 PRN jobs is when I decided to go and only work a PRN status, I had to narrow things down to what was important and significant for myself and for my family. And for me, it's my time, my freedom, and flexibility. So working PRN itself gives you flexibility, great flexibility as a nurse alone, but then having multiple companies helps me meet my other priority, which is being able to work as much as I want to work when I want to work. For example, if I decide that I want to work a particular day and I want to see a maximum of 5 patients, typically when I am working, I like to see as many patients as possible, meaning I prefer to see about 5 admissions unless I have a prior engagement or I just don't want to do it that day. So with me having 3 separate companies to pull from, I can build my own schedule within them 3 companies. On one particular day, if I want to work, let's say if I want to work August the 1st, 2024, and if one company only has 1 admission for me today, then they only have 1 admission. But if the other company has 3, and then the other company has 1 or 2 or 3, I build my schedule that way. So it actually allows me to work and have total flexibility, have total freedom over my schedule, but also it lets me make as much money as I desire for that work day, that work week, or the work month. Then outside of that, I always have myself a schedule, a planner, and I start off with on a blank slate for the actual month. So let's say that we were actually just planning for the month of September 2024, August 2024, December 2024. I start off on a blank slate and I kind of decide 2 things that I do. 1, I consider what's actually going on in my household. What is requiring my position, my attention. For my household, the way that we run our household, which is one of the reasons why I'm able to work PRN, is we live off of 1 income. We live off of the salary of the income that my husband brings into the household. Therefore, I am able to consider everything else and not disturb him from being out, going out, and bringing in the income that actually runs the family, that keeps the thing moving. Because I may decide that I just don't want to work. I've already decided, like, over a month ago, that I wasn't really working this month in August of 2024. I'm doing very minimal work. I am only working around my daughter's schedule. If she has something planned, if she have play dates and different things like that, that she is attending this month with friends, those are the days that I have been working. And that's how things will continue until she goes back to school the middle of the month. And then I will consider that day my first day back to actual work, almost like I have a new job. Okay, so I will plug in anything, her first day of school, doctor's appointments. I'll plug in days that I just don't like to work. Typically for me, I automatically kind of consider Mondays an off day. I don't prefer to work on Mondays because coming out off of the weekend, I like to reset my household that day. We like to do family things. Sometimes it's just chill and downtime. Sometimes we like to go to a movie, or we like to go to something that is seasonal. We do a lot of seasonal things here in my house or within my family. So Monday is like a reset. Everybody is doing everything, typically during a school year. My daughter is back at school. My husband is off to work. I do like what most people do on a Sunday, like a Sunday reset. Monday is that day for me. The stores are very empty. The lines are very short. I would drop my daughter off at school and I would keep going. I would go, and if I needed to make a quick run to Walmart, to Target, to the grocery stores, to Sam's Club, I would do things like that. So I automatically choose my own off days. I am thinking that 2 days is going to be my off days. Really 4. I'm thinking that my work days coming up will likely be Wednesday, Thursday, Friday, and I will be off on Saturday, Sunday, Monday, and Tuesday. However, if I wanted to work any of those days, if my daughter's friends' parents text or call and say, hey, can Alana join us and go here? And I know that they're going to be gone most of the days. Those are days that I would seize the opportunity and let the schedulers know that I am available. The other thing that I do is I prioritize my 3 companies. They kind of fall in number 1, number 2, and number 3. One of them, I always have visits that are relatively, all of them I see ortho patients from. But one of them, 99% of the time, I'm going to see an ortho patient. Those are relatively easy. I can stack as many of those patients on. I can take 5, 6. You all have seen me take 7 of those patients and still have that done in under 8 hours. A lot of people have been asking me about charting. I'm going to talk about charting in another video. But briefly, what I will say in regards to charting is this here. I kind of consider everything a full work day for me. So I determine how much time I'm going to be out in the field, and then I can kind of determine how much time I'm going to spend charting. I will actually show you all how much time it's actually taking me to chart. I'm going to do a very detailed video on charting. Charting can be very challenging, especially when you are a new nurse or clinician into the home health field. However, it just becomes like you become almost robotic. You just know, and you just click, 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 click. So I'm going to do some tips and tricks in that video and share that with you. So once I have my blank calendar, I will automatically, if I decide that Monday is definitely going to be a day off for me, maybe I will just automatically cross off Mondays. Now, because I also decide how much money I want to make, that means I determine how many visits I have to do to make that amount of money. So when I'm on a money grab, I may work on a Tuesday instead of having Saturday, Sunday, Monday, and Tuesday off. Tuesday, I may, if they text or call, or I may let them know that I'm available to see a couple of patients, but that would take away from patients that I needed to see later in the week. That could make me take a whole day off, maybe a Friday off, a Wednesday or a Thursday off, because I went head on and saw patients earlier in the week. Now, I'm not totally opposed to seeing patients on Mondays. I just know it works best for me. I just feel my house runs more simpler and easier if I take that time aside and reset the household on Mondays. So Mondays, if I was to work, it would probably be one patient, and the patient had to be very close to my home, because I would not take a patient on a Monday that gave me a greater commute than I wanted to, because again, that would cut into my day to reset my household. These are the type of things that I consider. So basically, I would say, let's just say if I broke my work week down that week to Wednesday, Thursday, and Friday, again, I would determine how much money I want to make that week, and then I would thereby accept that amount of patients to make that amount of money. The next thing, a huge, huge tip that I want to give you all, if you are considering being a PRN nurse in any status, a home health, the hospital, ICU, ER, just whatever type of nursing setting, I suggest that you try to get as little commitment as possible. I'll give an example. For home health, they usually like you to commit to a point system, meaning that you'll work X amount of points per week. Typically, home health hires in PRN status. A lot of them don't. So I am finding out that it's very challenging to get that PRN status, but I'm going to share tips and tricks about that in other videos. But typically, if they hire you on a PRN basis, what they like to say is that we want you to do a minimum of X amount of points per week. Okay, this is my answer to that. If you don't have them points for me, I don't make the money. So I can guarantee you, if you have patients and if I'm available, I'm going to see your patients. They either like it or they leave it on the table. If they leave it on the table, that is totally all right with me. It just means that is not the company for me. Now, if you find a company and they want to stick you with a point system, like one of my jobs, my first actual job that I used to work as a full-time admissions nurse, working 3 days a week, seeing up to 5 patients a day, their PRN status is really 6 points. That is very, very minimal. For me, that's basically 2.5 to 3 starts of care. I could, if I wanted to, commit to that. However, when I went over into a PRN status, at that time, I wasn't willing to commit to anything. I was very honest with them. I let them know that I'm willing to stay on. However, I am willing to stay on in a PRN status without a point system commitment. And they were fine with that. I had been with them for some time. Of course, I had taken some time off because my mom had gotten sick, but they were fine with that. That is a huge tip that I suggest, that you try to get a company that you have the absolute least commitment to. Don't get scared if they have a more of a point system. So I'm not telling you not to take those jobs if they have a greater commitment or greater point system. It is better when you're trying to juggle more jobs. I've never had any company, but again, I don't have a commitment. But if they don't have to work, they're not going to pay you. They're not going to pay you. So don't be scared to have a bigger commitment with somebody if you know that you're especially having it for the flexibility, you're on a money grab, you need time and control of your schedule. So most times the thing that's going to happen is the visits are going to go to the full-time and the part-time staff anyway. You're going to get what's left over, which is another reason why I have multiple jobs, why I have 3 PRN jobs, and even will be adding a 4th, because you get what's left over. They're going to give the visits to them first because they have to pay them their salary regardless. So I hope this helped. If you all have any other questions on how I schedule myself as a PRN home health nurse, please ask them down in the comments. Also, when I actually do my schedule for September, I will show you everything that everything that I consider, everything that's on my calendar, and how I'm really planning to break my work month down for the month of September, because again, my daughter will be back in school. I will have plenty of time and plenty of flexibility. So I'm just going to determine what's going on in my household and determine how much money I want to make, honey. Until next time, bye.